currently working with Doctors Without Borders, Medicine Sans Frontier. So first of all, I wanted to thank Professional Health. I wanted to thank the founder, Dr. Pavana Saranan, and the CEO, Dr. Sriram Arumugam. Thank you very much for this opportunity. And I'm very excited to be conducting our interview on a talk about SMA. So today we have our guest, Dr. Abhinand. Dr. Abhinand, welcome. The floor is yours. Please introduce yourself.
Hello, Dr. Gayatri. I'm Dr. Abhinand. I'm a lecturer at Sri Ramachandra Institute of Higher Education and Research. I have a PhD in bioinformatics, and I teach subjects like molecular modeling, structural biology, molecular biology, and proteomics. I also have 14 international peer-reviewed papers to my name, and I also authored 2 books. One of them is available on Amazon under the name Systems Biology, but not many people have read the book so far, but still it's there on Amazon. You can check it out. And I'm also a SMA warrior, which means I have spinal muscular atrophy, but spinal muscular atrophy does not have me.
Right. So could you tell us about the books that you have on Amazon?
So I've written 2 books. One is a book on systems biology, um, and it has a lot of case studies, and it's about a 200-page book. It's published by the LAP publishers, Lambert Associate Publishers. And the other book is published by Springers, and it's a book on biopesticides. I have not written the entire book on biopesticides. I have authored 2 chapters among the 20 chapters of the book.
Right. Okay. So I had also read in your profile that you have 14 international publications. So could you tell us a little bit more about the current research project that you're working on?
So my papers are mostly in the area of molecular modeling and protein structure prediction. The current paper I'm working on is a study on the future mutations in the spike protein of SARS-CoV-2. What kind of mutations can occur in the uh, near future? It's a random forest and artificial neural networks based prediction algorithm development for predicting the future mutations, and what kind of structural changes will happen in the spike protein, and how that might affect the efficacy of the current vaccines, including the Moderna, Pfizer, the AstraZeneca, Covishield. So how these vaccine efficacy is going to change because of the future mutations that might occur.
Right. Okay. So you have mentioned right now in your introduction that you are an SMA warrior. So can you please tell us more about spinal muscular atrophy?
The spinal muscular atrophy is a neurodegenerative condition. It's a genetic disease that robs people of physical strength because it affects the motor neuron cells, the spinal cord, and ultimately the people lose their ability to walk, eat, or breathe. And it's an autosomal recessive condition, which means that both the parents must be carrying this particular mutation in the survival motor neuron gene 1, SMN1 gene, and only then the child would have the disease. And it causes muscle weakness and progressive loss of movement. And even simple tasks like walking, sitting up, moving the head, or even swallowing becomes progressively difficult. And SMA is not a single disease, it's of 4 types. There are 4 types of SMA, each of them differing in the um, level of progression and how much it affects the body. It varies greatly between individuals, and though the characterization is kind of not very concrete, it's a little fuzzy, but still we categorize it into 4 types. So SMA type 1 is the most severe type, that's the more common one. These children are never able to sit independently. The symptoms are evident at birth. The children do not suckle, they have problem feeding and swallowing. Kid does not stand. Breathing is very, very difficult. Most of the children don't cross the age of 2. And then we have the type 2, which is called the Dubowitz disease. It's a less severe version compared to the type 1. It manifests between the age of 7 months and 18 months. The children are diagnosed with SMA2 a little later after 6 months, and they can sit, but they are usually not standers. They might stand using some kind of orthosis, but walking is very difficult. With good medical care, they might have a kind of normal lifespan, but breathing is also affected, so that's a problem. And type 3, that's the type I have. This type is also called as the Kugelberg-Wiellander disease. The manifestations are seen after 1.5 years of age. So people like me, we stand and walk till a particular age. I was able to walk till I was 13 years old. After that, I've been wheelchair bound. I've not been able to walk after that. And I was able to stand until I was about 20, I guess. And after that, the type 3 people, they need a wheelchair. Life expectancy is about normal. And then also we have type 4 people. Type 4 people have an adult onset of the disease. Usually above the age of 15 is when the disease starts. And the progression is very, very slow. They have almost a very normal life.
Right. So you have mentioned the four types and that you have type 3, right? So
Yes.
as we are aware, the incidence of SMA is 1 in 10,000 children. This means that most of the patients who have SMA are patients with SMA type 1. And as Dr. Abhinand had mentioned, they unfortunately do not live beyond 3 years of age, which indicates the importance of knowing about SMA. So I wanted to ask you, when did you first notice the symptoms? I mean, you had mentioned that at 13 you were not able to walk. So from 13 years of age only were you aware, or did they start much earlier? And did you notice changes? Did you notice any differences much earlier than 13 years of age?
So when I crossed my first birthday, I started talking as soon as I was 13 months old. I must have been a really smart kid, I guess. But then I didn't have other milestone delays. I never crawled or I never stood up, and I never started walking until even after my second birthday. So just before my second birthday, my parents were worried about me, and they took me to the neurologist, and they found out that something was wrong with me. So around the age of 2 is when the initial diagnosis was made. But I would admit that it was not a clear-cut diagnosis to start with, because back then we don't have the genetic test that we have today. It was only tissue biopsy, EMG, and serum creatinine levels. So these were some of the tests that were available back then. So the doctors here, with all their expertise, they could only come to uh, approximate diagnostics that it can either be Duchenne's muscular dystrophy or it can be spinal muscular atrophy. But they thought it was spinal muscular atrophy, but they were not like 100% sure because of the lack of the genetic test. And around 2001 was when they were able to say for sure that I had SMA type 3 based on how my symptoms were progressing. It was not as bad as inductions. And in 2002, we also had a Canadian neuromuscular expert who had come to Chennai. And then we had a clear cut diagnosis in 2001 when I was 12 years old.
Right, I see. So we know that SMA is caused due to mutations in the SMN1 gene. And of course, there is the SMN2 gene as well. So I did read that the severity of SMA depends on how many copies of the SMN2 gene are present. So, for example, if there are less number of copies of the SMN2 gene, then the severity of the SMA would be more. So I wanted to ask, particularly since you have type 3, how many copies of the SMN2 gene you have? How severe is your SMA?
So the SMN1 and SMN2 genes both need to produce the SMN protein. SMN is survival motor neuron protein. But the SMN2 gene is less efficient in making the SMN protein, but still it makes the SMN protein to some level. So more than number of copies of the SMN gene, SMN2 gene, the severity of the disease would be very less, as you rightly mentioned. And I'm unlucky in a way that I have only two copies of the SMN2 gene, which means that I should have most probably be in type 2, not type 3.
Mhm.
Uh, it's a very, very rare thing that a type 3 child has only two copies of SMN2. But I'm one of those um, genetic wonders, maybe. I mean, less than 1% of people in type 3 have only two copies of the SMN2 gene. So I'm maybe one among 100 in the type 3 itself.
Right.
Okay.
So, how did you feel about being diagnosed with SMA? Did you understand the gravity of the diagnosis?
When I was
And
a child, I never
yeah,
understood the diagnostics much. It was not very, it was not affecting my life much. I was able to walk. I was never a runner, or I was never able to jump, but I was able to have a kind of normal childhood. My parents also made sure that I went to a normal school along with other children. So I was able to play along with other children. I even played gully cricket. I was a leg spinner back then. Um, so I had a normal childhood. So the fact that I had SMA did not affect my childhood much. It was only after 13 when I stopped walking. That's when things started to appear difficult for me. The toughest years, I would say, were around 16 or 17 when I was in my 11th and 12th grade, where I would find it tough to go to the tuition classes, where all the other classmates would go to. So that was a tough phase. So that was when I had a low confidence and I suffered mentally a little bit during that phase. But then I always had extraordinary friends all my life. My friends have always compensated for what I lacked in the good genotype. Though I had the wrong mutations, um, nature made sure that I had the right kind of people to compensate for that.
right, that's very beautifully said. So, the next question I wanted to ask you, it's a loaded question. How do you think society perceives you?
So as a child, the society did not perceive me very differently. As I told you, I was quite like any other normal child. But I would say the society has been very, very kind to me. I've had a really good deal from the society till date. I've only been with the best of people all my life. To be honest, I would even say that I'm yet to meet somebody who's really, really bad all through my life. I've lived 33 years. I'm yet to meet a really bad person. Almost everybody I've seen have been good to me. And uh, my teachers have all been really nice. And I never suffered from low expectation just because I had a disability. Uh, all my teachers, they expected the best from me. And even now, when I go back to my school or my kindergarten teachers, they are not surprised by the fact that I have a PhD today or I teach 250 children a year. They're not surprised by that. They were like, it was expected from you. You looked capable of these things even when you were 3 years old. So society did perceive me in the right way. But once in a while, there is some kind of discrimination. That's not because people are unkind, it's more because of lack of understanding of the disability etiquettes sometimes. Like I go to a restaurant, the waiter or the waitress doesn't talk to me much. They try to ask my companion what I would like to eat. That's a bit irritating sometimes. um, these are some simple things. Or there are some people who come and tell me that I look really handsome for somebody on a wheelchair. I mean, they could have said I look good for I look good for someone who's 33. Instead, they say I'm really good for someone on a wheelchair. That's not a nice thing to say, but those are very, very, very rare things, not very common. Otherwise, the society has perceived me with absolute kindness and with a very fair approach. I'm very thankful that I was born in this country, this part of the country, where the society has been very much loving and accepting, and uh, they have been really nice.
Right. So the thing is, your teachers had a lot of faith in you, your friends. There were so many people who believed in you as a person, and here you are today. So that is extremely nice to hear. The other thing that I wanted to ask is, do you feel comfortable if people were to approach you and ask questions to you about the fact that you're on a wheelchair, or would you feel comfortable if people were to question you, come up to you and ask personal questions?
When I was young, that was very, very uncomfortable. I didn't like talking about my disability at all. Unless I wanted to choose somebody and talk with them because I'm comfortable with them. I was always uncomfortable talking about anything about my disability. But now, as a more matured adult, as somebody who has seen a bit of life, I'm very comfortable talking about anything about my disability. I'm not uncomfortable at all. So even at the end of the session, I would be very happy if anybody were to ask any question regarding SMA, about my journey with SMA. I'd be really happy to answer. I'm not hypersensitive about any of those issues. I can answer any of those topics with a big smile on my face.
Right. Okay. And exactly, because you had mentioned in your Quora profile, which I did see, that you would like to be known for your achievements, for the person that you are, rather than for the fact that you have done it from a wheelchair, right?
Otherwise,
So I think that it's so important to recognize people who are differently abled for who they are, rather than the disease that they are afflicted with. So
absolutely.
you're also mentioned that you've traveled to so many places, and can you tell us a little bit about which are all the places that you have gone to, what all you have seen? Which also strikes my mind, that what about the accessibility that you've had? Like, were you able to access these places easily? Uh, how is it, traveling to these places on a wheelchair?
So I have traveled quite widely, and it's all because of my friends, because they have made sure that I never left out. I've traveled widely across the Western Ghats. I'm actually I love the elephant corridor in Mutsanga, Mudumalai, and uh, Bandipur. I go to Nagarhole almost every year. I love spending time with nature there. I've been to Ladakh, I've been to Manali, I've been to Amritsar. Um, I have this wonderful bunch of friends. So they have made sure that I'm taken everywhere I go. So uh, Bharat, Hemnath, Yunus, Ashraf Ali, so uh, Manigandan, and my caregivers have also been really kind to me. So these people have made sure that I'm taken everywhere they go to, and I'm never left out. I have really enjoyed a really blissful adulthood, traveling to places that I love.
That's fantastic. These photos also look amazing. So it's wonderful. How about the accessibility when it comes to your campus, or, say, for example, public transport or things like that?
So I would say that things have improved dramatically ever since I was a teenager. So I remember a time in early 2000s when I would have nowhere to go to in Chennai except for Spencer Plaza, because that used to be the only wheelchair accessible place. Even Marina Beach was very difficult to access back then. But today, government has made sure that ramps have come up in every part of the city. And I go to the High Court of Madras for some legal issues, and even there it's absolutely wheelchair friendly. The post offices are wheelchair friendly. Uh, the government libraries are wheelchair friendly. Almost every government office is equipped with a wheelchair friendly ramp and an elevator. Those are good things. And the new buildings that are coming up, they all have government stipulations that you have to put up a ramp over there. So those are really nice things. And when I studied in school, the school was really loving. People loved me at school. The teachers are really kind. The administration was also nice. But one problem I faced was there was an absolute lack of accessibility in school. I don't fault the school. School is in middle of a residential area where there is a very little space. So I had to come down to the ground floor for a laboratory class, or I had to go to the second floor to use the toilet. My classroom would be in the first floor, so people had to carry me up and down. I'm really grateful for every one of the friends whom I had at school. um, I would love to tell all their names, but it's not feasible to do that in a 30 minutes interview. I'm grateful to every one of them who did that for me. But when I went to my undergrad college, my college was also not very big in campus size, but the wheelchair accessibility was much better there. So my confidence levels went up multifold when I went to college. In my undergrad, the place I did my undergraduation, it's a college called Kumara Rani Meena Muthiah College. It's a tiny place. Um, we had less than 800 other students, but the campus was wheelchair friendly. That made a huge difference to what I could do, what are the activities that I could take part. So that made a huge difference there. And when I came to Ramchandra, it became a whole new world, because I would say frankly that Ramchandra is one of the most wheelchair friendly places across India. I've been to many other universities in other states also. I've been to universities in Gujarat, where I did a little bit of my research work. So, compared to that, um, anywhere else, um, the the campus of Ramachandra is much, much, much better in terms of accessibility.
Right. So, in other words, a simple ramp changed your life. It gave you confidence. And it's so important that we campaign for uh, uh, accessibility, that we know we change our places of work, we change the setup in our communities. We can advocate for a change in our places, and it's so important that the key point that I got from his message is that a ramp gave him confidence. So
Yes,
that was very wonderful to hear.
I'll give you a small anecdote. When I first came to Ramachandra, the central library of Ramachandra is situated underground. So you would obviously know where the library is, right?
Yeah,
So,
exactly.
and the
It's in the basement. Yes.
it's in the basement, along with
Yes.
the auditorium is also in the basement, one of the auditoriums. So I had a very difficult time accessing either the library or that auditorium where the important talks or the CME programs used to happen. So the administration, when they came to know about this difficulty, they made sure that they put up a tiny lift which can accommodate my wheelchair, and made sure that I was able to access the library and the little auditorium in the basement. So that was a huge step that they took up. So if all organizations across the country can accommodate the disabled people and their requirements, like how Ramchandra has done for me, I think the country would be a much better place for the disabled people.
Definitely.
It's not just the government, but the individual people, individual organizations. Everybody needs to own up the responsibility and make the places more wheelchair friendly.
Definitely. It is our individual prerogative. And I wanted to ask if you have a community of people who share a similar experience as yours. Do you have a community that you can talk to, fall back on?
Right. So we do have an organization called Cure SMA India, right? So Cure SMA India is organization run by the uh, parents of the children who have spinal muscular atrophy, along with the adult SMA patients like me. So it's not a very old organization. The organization was started only in 2014 by a group of parents with SMA children, and the organization has been a huge patient advocacy group. They have made public representations about SMA consistently over these 7 8 years. They have been advocating for a broader access to the available and approved medications, and to get our children enrolled in clinical trials, and more importantly in compassionate usage program for the medications. And they have we now have about 650 families that are registered with the Cure SMA group. And so Cure SMA is a big family of about 650 to 700 members. In our Tamil Nadu itself, there are about 40 members in Cure SMA group. It has a pan India representation. When it started, there were about only 10 families. Now, imagine we have 700 families. So it's been a humongous growth for the organization. And it's a very important group because it gives supportive care. It does patient advocacy. It tries to help poor patients, illiterate patients with diagnostics and counseling care. And they also set up SMA camps. Online programs are conducted every week, um, almost every week at least. And they make sure that everybody gets access to the facilities and the important information that is needed for every parent whose child has SMA, or every adult who's suffering from SMA. So Cure SMA is a boon to everybody with SMA in India. So I'm really happy and proud to be a part of this organization.
That's fantastic that you have a community of people to talk to. Who you have a community that can share valuable information, much needed information, and I'm sure that the psychological support that you receive would probably be very immense. I also remember reading an article where Cure SMA for Mother's Day had conducted a program, isn't it?
Yeah. And so they
Yeah.
had um, event where the mothers got a chance to share their experiences, and uh, psychological help was also provided to the mothers, because mothers are the ones who share the maximum burden uh, of a family member with SMA. So, so we often say in the Cure SMA group that um, God couldn't be everywhere, so He put a mother everywhere where a SMA child is. So that's how it works. So mothers are the most important people. I mean, fathers are important too, but yeah.
Yeah. Right. So, is there any medications that you're currently taking specific to SMA?
SMA comes with a lot of other associated complications, like many of the SMA patients have problem with digestion. Like I have peptic ulcer, which is recurrent. I keep getting it again and again. Even as I'm saying this, I'm burping. So um, I, I I am on proton pump inhibitors like Nexpro for that, and for the neurological pain, I take Galantin. Um, and because of breathing difficulties and asthma I suffer from, I take medication for that, 4-cortinyl Deriflin, but not any SMA specific drug. But there are three treatments that are available today. They are namely Spinraza, Zolgen SMA, and Evrysdi. And one of that, which is Evrysdi, is only available in India. Evrysdi is also called as Risdi Plan. That is the only medicine that is DCGI approved, Drug Controller General of India approved. It's available from India in India for the past 20 days only, not before that. So risdiplam or Evisdi, however you call it, that's the only medication that's available. So this
Right.
Zolgen SMA is the world's most expensive drug. You might have heard about it. It's cost 16 crores. There are some parents who have tried to do a crowdfunding for their children to get access to this Zolgen SMA drug. It's a gene therapy, and what they try to do is they try to clone a functional copy of the SMN1 gene, and they put it into an adenoviral vector and try to transform the human cells with that. So it's a gene therapy that costs around 16 crores. And then there's the other medication called Spinraza, that was the first SMA medication to be introduced back in 2016. And here it's antisense oligonucleotide therapy, where they try to repair the damaged SMN2 gene. So it works by that. And risdiplam is a medicine that is made by the Roche company. And it was introduced back in, I think, 2020. And 1 year later, now it's available in India. And this particular drug works by increasing the SMN2 protein levels by altering the splicing pattern, and thereby making the SMN2 protein more stable, and make it produce a functional SMN1, I mean, survival motor neuron protein in large quantities. So this risdiplam is the only available cure, not cure, but a proper treatment available for the SMA children, SMA adults in India now.
So basically, what you're saying is that risdiplam will prevent the progression of your SMA.
Yeah.
Does it mean that it will stabilize your SMA at the point that it is, or does it have these like could it possibly even reverse some of the complications
Like,
associated with
no
SMA?
medication is ever going to make a person like me to run or walk again. That is not possible. But this Evrysdi or Risdiplam, if it's taken, it can stabilize the disease, stop further deterioration, make sure that my condition doesn't become progressively worse, and there can be some improvement in the motor function. I can't say for sure what kind of improvement can be seen, but to some level, it can improve my motor movements to some extent.
Right. Okay. So we have come to the conclusion of our talk. So thank you. Thank you so much, Dr. Abhi, for talking about your life, for giving us insight into you as a person and what it means to have SMA. Of course, I do want to say that Dr. Abhinand is fighting to get access to Risdiplam. But Risdiplam is beyond the common man's reach. It costs nearly 70 lakhs a year to get access to this life saving drug, and a lot of people have been fighting for it. And this is where you, as an audience, come into play, because your contribution is going to help Dr. Abhinand see a tomorrow that we take for granted. It's going to extend the quality, it's going to improve the quality of his life, and it's going to help him live longer and help him contribute to society and achieve all the dreams that he has. So we request your help and we request your contribution. No contribution is too small, because even if we get 100 rupees from a single individual, if we are able to reach out to 1 lakh people, it transforms into a crore. So I hope that you gained knowledge, that you understood what SMA is, and that you help us in generating awareness, and you forward this message to your family, your friends, and your colleagues. Um, we have now opened the floor for questions from the audience. So I'm already seeing a lot of questions in the chat box. So please go ahead. I will be reading the questions to you, Dr. Abhinand, and you can answer them. So let me just open my chat box. Okay, so let's see. There is a question that says, did you face any difficulties due to SMA in any way during your prestigious medical career from patients or colleagues till now?
So I would like to clarify that I'm not a medical doctor. I don't have a BBS. I have a PhD in bioinformatics. I'm a doctor by research, so I don't deal with patients on a regular basis. I don't have anything to do with patients. But my mobility, or rather the lack of it, is a bit of a problem when it comes to commuting and going to work and coming back. But that has never prevented me from expressing myself or working to the best of my abilities. So my um, primary career is as a teacher and then as a researcher. So if you ask me if there has been any difficulties, yes, definitely. But has it stopped me from achieving my potential? I don't think so. I've been able to do whatever I can.
Right. There is another person who has asked here. He says, so can you say about the daily life needs in an SMA patient? I think what he's trying to ask is, what are the um, daily requirements, like how
Right.
you go about your day?
So as I told you, SMA is of four types. So um, a, a patient who's having type 1 would have obviously different types of requirements from somebody who has type 2 compared to somebody with type 3. So I can talk about myself first. So as a type 3 SMA patient who lost his ability to walk when I was 13, I needed a really good support structure, which I got in form of my friends. So they have been really kind enough to take care of me at school, at college, at work, and I've been also lucky enough that I've had a caregiver for the past 10 years. So the caregiver is a very important part, because as the parents grow old, it might be very difficult for them to take care of the SMA child individually, as the child is also growing up. So it might be a difficult thing for the parents also to do. So having a caregiver is very important, and regular medical checkups are essential, because SMA can affect the respiration. It can also affect the cardiac system. So we need a regular checkup from a cardiologist and a pulmonologist pretty often. A dietitian plays an important role, because not everybody with SMA would be able to digest all kinds of food, and there are special dietary requirements, like high protein intake is required for SMA patients. And due to the sedentary lifestyle, we tend to put on weight more easily than other people. So that also needs to be taken care of. So these are some of the daily life needs, along with the daily medications that I was talking about earlier. Drugs for my peptic ulcer, or drugs for my neurological pain, or the drugs for the respiratory care. So they are also some of the daily needs. And availability of a quality wheelchair is also very important. And public transportation for SMA patients till very recently was absolutely um, not there, absent. But with the metro project coming up, the accessibility has improved. So once the metro train project in Chennai is completed, the people of SMA community of Chennai would actually rejoice, because they would have access to go to any part of Chennai with ease. So that is also part of the um, daily requirements.
Right. Another question has just come in. This person asks, does physiotherapy help extend the walking ability or mobility, rather?
Yeah, physiotherapy is very, very important. So whatever limited motor skills that SMA patients have, that needs to be prolonged as long as possible. And if you can see me, I have a scoliosis, which means curvature of the spine. So the curvature of the spine needs to be monitored and taken care by a quality physiotherapist. So a good physiotherapist is extremely important in making the life of a SMA patient better. And even for respiratory health, doing something like spirometry on a regular basis, doing breathing exercises, or even yoga exercises like pranayama, all that can help a SMA patient to a large extent. So, role of a physiotherapist in making the life of a SMA patient better is very, very big. So, we need quality physiotherapists who have essential experience in dealing with SMA children, SMA adults.
Okay. And very nicely put. Another person is asking, so as an SMA veteran throughout your life, have you had any regret that if you were a person without disability, uh, would you have done things differently?
Yeah, as a very normal person with a normal psyche, I do have my regrets. uh, Sometimes, not always. I would have maybe traveled across the world. I'm a, as I told you, I'm a very avid traveler. I love traveling. So if I were more healthier physically, maybe I would have traveled to more countries. And it was my dream to do PhD in the field of genetics or genomics. I could have done that in an international university if possible, or I could have gone for my postdoc to some international university. Because of my um, lack of mobility and my lack of upper limb strength, that's why I chose bioinformatics as a career. I mean, I don't regret it. I love my subject, but maybe I would have chosen some other field of biology, like upper structural biology, something like that, if I was physically more able. But then I'm really happy with whatever I have now. No regrets.
Definitely. Nothing has stopped you in the sense that uh, you have your PhD, you have 14 international papers, you have gone places, and you do it with such aplomb and with such confidence. So, that is definitely extremely motivating to hear. So thank you so much. Thank you so much for your time, Dr. Abhinand. And
We
there,
have one more question.
we have one more question. Yes. So uh, once again, on behalf of all the people who are suffering from various disabilities, what would you like to say so that all these special people will be motivated and reach a certain height as you did?
So, all human beings are having some kind of constraints, some kind of limitations. So we shouldn't let ourselves get bogged down by that. But it's very easy for me to say that because I come from a position of privilege within the disabled community. I've had understanding parents, supporting parents. My grandmother has been a huge support factor. I've had great friends all my life. Not everybody is endowed with that. So some people have it much tougher than what I have. So, but the thing is, everybody can make a difference. Everybody can reach the height of their potential if they can put their heart and soul into it. But then I would thank God, thank nature that I've been having a little more privileges than average disabled. Not little more, actually, way more privileges than an average disabled person in India has. But it's all about what you make out of it. And life is not about surviving, it's about enjoying life and flourishing. So that's one message I would like to give to everybody.
Yes, as you had very beautifully put it, that each one of us is capable of making a difference. We never know the impact that we have on someone. We never know how much we could change someone's life. So, thank you so much for beautifully describing it.
And one small request, so Sriram has put up the link
Yes.
for the fundraiser. So kindly look at the fundraising link, and if you can make a contribution to that, please do that. Or even if you are not able to make a contribution, kindly share it with other people. So this is how the fundraising link looks like. So you can make a small contribution, whatever is possible to you, or you can at least share it with other people. Thank you so much. Thank you so much for hearing my story. Thank you so much for listening to what I had to offer. Thank you so much for the professional helps group for giving me a chance to address this audience. Thank you.
Thank you. Thank you. Thank you, Dr. Abhinand. Uh, Special thanks to professional helps who sat with us and helped us with everything. So I really wanted to thank both the founder, Dr. Pavanasaran, and the CEO, Dr. Sriram. Thank you. Thank you to the audience. Thank you for joining in.
Sham Sundar has something to say.
Yes. Sir. Uh, do I press the open queue button? Okay, I'm going to press that. Is there a question?
Okay, no
Could,
more
could,
questions.
could you please type in the chat box?
No, no problem. Thank you.
Okay. Thank you so much. Thank you so much for your time, and thank you to Professional Helps once again. Thank you, Dr. Abhinand,
Thank you.
for sharing your story. Okay.